Part 34, Chest Compressions in Child CPR. Welcome to the lesson on chest compressions in child CPR. In this video, we will discuss the steps of how to do chest compressions in children. Child CPR, compressions. The steps of CPR in children are similar to these in adults. The main goals are early administration of CPR and pushing hard and fast on the chest, and giving breaths. Children who appear adult size can be treated as adult for the purpose of CPR. As a rescuer, if you are untreated in CPR, give hands-only CPR, continuous compressions but no breaths. Providing compressions to a child. To do CPR on a child. Step 1. Position the individual on their back on a firm, hard surface. Step 2. Move clothing away from chest. Place the heel of one hand on the lower half of the breastbone. Step 3. Push straight down approximately at least 1/3 the depth of the chest. In most children, this is about 2 inches, 5 centimeters. Compressions should be delivered at a rate of 100 to 120 beats per minute. Let the chest recoil to its normal position after every compression. Performing CPR can be tiring. If someone else is available to help, change roles every 2 minutes and work to minimize the pause in between compressions. This concludes our lesson on chest compressions in child CPR. Next we will review giving breaths in child CPR.